Let's start that again. Good morning, everyone, and welcome to this special edition COVID-19 panel discussion with medical experts from Tallahassee Memorial Healthcare and Capital Health Plan. My name is Skip Foster. I've got a little consulting business. I used to be the publisher of the Democrat, and I'll be your moderator for this session. I'd like to welcome our audience from WFSU. The first half hour of this webinar is airing on WFSU at 6:30 on Monday. If you have a question during this discussion, please submit them using the Q&A feature on Zoom and the comments on social media. This discussion is being recorded and will be available to be shared and rewatched shortly after we have concluded. Also, this would be a good time to message your friends and have them tune in so that they don't miss any of this. Okay, so let's get straight to the questions and to our experts. I'd like to welcome our two experts right now. First, I'd like to welcome Dr. Andrea Friall, who is the Vice President and Chief Medical Officer at Tallahassee Memorial Healthcare. And I'd like to also introduce Dr. Dean Watson, who is the Chief Integration Officer at TMH and Capital Health Plan. And so let's start with you, Dr. Watson, and just give us a status report of the current state of the pandemic at TMH and in our area.
Sure, thanks. Good morning. I'll try to go reasonably slow for a lot of numbers to talk about, but currently at TMH, we have 69 patients within the facilities. Of those 69, 9 completed their vaccination series, so that's 60 that did not. So the other numbers that we look at locally are kind of 7-day trends, the trajectory as you may call it. So 80% increase in cases over the past 7 days, greater than 15% positivity rate, which is significantly higher than we're used to, 81% increase in hospitalizations, which is not what we want, and then 12% increase in ICU admissions throughout our Leon County region or area. So all numbers that are not good. When you look at the 69 patients with COVID within our facility, the reason why that number fluctuates so much is because of two reasons. One, we have the ability to partner with community partners as well as our rehab center to move patients back and forth that have COVID, and two, people are dying. So, and they're dying at a young age. And so those numbers do reduce on a daily basis based on those two factors. Plus the third is working aggressively on getting patients moved out to their homes on home oxygen and monitored from their homes. So those are kind of the reasons why you'll see those numbers fluctuate.
So thank you, Dr. Watson. Do y'all do any type of modeling where you take data and say, hey, it looks like we're close to peak or not close to peak or past peak? And if so, what does that look like right now?
Yeah, so we look at it every day. We actually do a US review looking, and then we look internationally to see kind of what this Delta variant's doing internationally. We're still peaking locally. We're still peaking in the state of Florida. We're unfortunately in the state of Florida, the leaders of the pack, which is not something you want to be. It's not the medal we want to carry or the trophy we want to receive, but we look at it every single day. We're still peaking. We're hoping that with some of the things we're going to talk about today, people will listen and make a good decision and impact the peak, and hopefully over the next 4 to 6 weeks start to see a trend down.
And what about the impact on non-COVID medical services? I know that was an issue back in prior peaks. What are we seeing as the impact there for folks that just have heart problems, cancer patients, maternity, that type of thing?
Yeah, Skip, we're kind of going backwards in a sense that now the impact of the increasing in hospitalizations for COVID patients has, in addition to affecting the workforce, so able to come to work, impacts our ability to care for patients on an elective, in an elective fashion. So Right now, we are currently still doing procedures. However, the impact for scheduling elective cases or cases that can wait has been that if you require an overnight stay or an ICU bed, those cases are going to have to wait. We're still able to perform surgical procedures and other procedures. Right now, we're still doing this, but it does limit us on those ability to do those other cases that if you were scheduled in 2 weeks to have something done and require an overnight stay, we're looking every day because this is such a fluid process. A couple of weeks ago, we had to start implementing cessation of having patients that needed an overnight bed being able to have their procedures. So right now we are still doing procedures, and it's a daily process that we're looking at. What's next? If for those patient, people that are out there that are saying, well, hey, I'm just going to wait and see what happens. Well, we waited and we saw what happened, and it didn't get better. Now we're worse than we ever were, in a sense that at our peak in the past, we may have had 50 hospitalizations. We've been over 80 for inpatient COVID patients, and that does impact our ability to care for patients in our community and surrounding areas.
So I want to ask about, and this is a question that just came through from a viewer, and thank you for submitting those, and keep them coming, please. And this is a question I had as well, and that's about so of the severity of the cases of vaccinated people. So it looks like it's been roughly 10 or 15% of your admitted patients. How many of those, so between 8 and 15, are in there? How many of those have been in the ICU? Are they just as susceptible to severe cases, or are they at a level below?
Yeah, I'll take that one. Just, I want to be as clear as I possibly can. The individuals that are vaccinated are doing well. 99% and greater, there's different studies out there, 99.2 to 99.5% of deaths are coming in unvaccinated individuals. Our ICU population of our 15, and probably I haven't checked in the last 2 hours, maybe up to 17 or 18 patients, 1 was vaccinated, 1. And they all end up doing well. You just can't emphasize this enough. This is an unvaccinated pandemic currently. And I just want to address one other thing, because people use the term breakthrough all the time, and it just kind of, I don't know who coined that, and it was a wrong term. The term should be expected, right? So if we know vaccines work 88 to 95% of the time currently against Delta, when we see 12% of individuals come in and they're like, well, I'm infected and I got the vaccine. Yes, we expected 12% of people, if it's 88% effective, 12% may actually get an infection. Here's the good news. It's expected. You're going to do very well. You're not going to die. You're not going to, have severe illness. It's protective. So I just want to clarify that, because everyone on the news, all you see is breakthrough case, right? Well, read into the details of the new news article. They're thanking themselves, or they're thanking everyone for vaccination because it's saving their lives.
And is it also fair to say that the vaccinated people that are infected tend to be vulnerable anyway? I mean, those folks tend to have more comorbidities and things like that. Is that fair?
Yeah, absolutely. And the other thing I would say, since you're bringing up the vulnerability, I just want to, we'll talk about this in just a little bit, or maybe this will be a segue into that conversation. Let me explain who we're seeing in the hospital right now, so everyone gets a really good understanding of what we're dealing with. In the past, in the original surge, we saw elderly folks with comorbidities, meaning a lot of medical issues, and they were not doing well, right? Well, we figured that we didn't have vaccines, and this is the highly vulnerable population. What we're seeing now are individuals that are in their 20s, 30s, 40s, 50s. We're not seeing the 65-year-olds because they're vaccinated, 85% of them in Leon County, fully vaccinated. And let me explain. In our ICUs right now, we have 20, 30, 40-year-olds, and many of them are not going to survive. They don't have health issues. The people that are sitting up, we have various COVID units in the hospital to handle this. Our COVID unit that sits on the 5th floor has over 30 patients They, in the past, would have been considered ICU patients. We've adjusted how we are maneuvering through this disease, and we have them on the 5th floor. They're in their 30s, 40s, and 50s. They're otherwise healthy, folks. This is not the same virus. The Delta virus is very aggressive, and we're seeing a very different population.
And just to add to that, from the
Sure, go ahead.
beginning, we know that, thanks, Skip. We know that viruses can mutate for the best or for the worse. And unfortunately, we're seeing more virulent or more easily contagious variants of the virus. But when we talk about the vulnerable population, I cannot go without saying that currently it is recommended that the pregnant population get vaccinated. Both the Society for Maternal Fetal Medicine as well as the American College of OB/GYNs all have come out as recently as July 30th to make sure that this very vulnerable population does get vaccinated and recommend that it's safe. So we just have to make sure that message gets out there.
Okay, so I want to go to a couple more viewer questions, and they are pouring in, I should tell you, doctors. So that tells you that folks are engaged and interested, and we appreciate you taking the time. I know you've got a lot of things to do. What did we learn? So there was a lot of talk during the prior surge about the impact of school starting, and in particular our universities, right? So young people coming to town, they tend to be unvaccinated, or at least their vaccinated percentages are lower. What did we learn from the prior influx of college students, and what do we expect from the one that's happening here in the next few days?
I'll start, and then Dr. Friall can jump in. What we do know is that the younger populations, these 18-year-olds, 19-year-olds, and below, do reasonably well, or they have in the past, right? And this is pre-Delta. We know that they're going to do reasonably well. Our concern, and I'll repeat what I've said in past conversations, is yes, I'm very concerned about college age and younger students. I think they should be vaccinated. Clearly, that's why we're on the show. But they will do well. My greatest fear is how they're going to spread it to others that are vulnerable, others that may not do as well. We learned that. This is what happens. We see folks that come in pockets, if you will, or that impact numerous people from one individual. That's our concern. These kids are going to go back home. They're going to be with college professors that may not be vaccinated. That scares us to death. And we do need people to think about it. We recognize personal choice. We 100% recognize personal choice, but we recognize even more personal responsibility. And I think it's the responsibility of individuals to really consider the impact of their decision. And we'll talk a little bit more when we get to vaccination, but that's my feelings. I don't know, Dr. Friall, if you have.
Well, let me kind of pivot to this question for either of you then. You were talking about 20s, 30s, 40s, 50s being your current admittees, including ICU. Is there some kind of gradation? If I'm, even with that reality, if I'm 22, am I in better shape than if I'm 32 or 42, or is there equal risk kind of now up and down the age spectrum?
Unfortunately, I hate to break the news that is over. So okay. We're seeing, everyone, I want you to hear me loud and clear. We have 20-year-olds dying from this, okay? And so I need people to take this very seriously. Now, look, this is not about running around and waving your arms and you know, the world is ending. It's not ending. What I'm saying is do your research, understand the significance of this. This is not 65 and over comorbid people dying. This is 40-year-olds dying. This is 30-year-olds dying. Here's the difference. 30-year-olds, 40-year-olds, 20-year-olds, they last longer, if you will, in a very, very bad state because their body is in great condition. Well, when your lungs give out and you're sitting on a ventilator, that's going to be a 3-week or 4-week journey, whereas my age group or above, it may be a 1-week or 2-week journey, right? So that's what we're seeing. Back to Dr. Friall's point is we're filling up a hospital with patients that are taking a lot of resources to try to help save their lives. This could all be prevented. All of these people, all of these resources focusing on these patients, and we do care about them. We do care about everybody on this call, but it impacts you and your families because when you get sick, not from COVID, but you have other issues, you may not be able to get the care you need immediately because of this.
So personal choice you know, I choose whether or not to wear a seatbelt, and if that choice really affects nobody but me. Personal responsibility is a DUI, right? I'm putting other people at risk.
Yeah.
Now, we've made a law about even seatbelts, so there's personal choice issues that we've kind of taken out of people's hands, but this is more like DUI, right? Where you're jeopardizing yourself and others.
Yeah, I'm gonna. I'll
But
start
even
with
in a
this.
personal, oh, go
Yeah,
ahead,
let
Dean,
me
I'm
start.
sorry.
Let me start, and then you clean it up, because I want to talk about this real quick. Dr. Friall will clean up my mess when I'm done. I really, we're living this 24/7, and we're passionate about taking care of people. We want the best for everybody in the community, but we have got to go from an I, me to an us, we. In other words, I make a decision about me. I support that. But if it impacts 100 other people, and I'm going to hurt somebody else because of my decision, that's an issue. So an I, me to an us, we, right? So when I make a decision that impacts others, I'm going to impact everybody around me, myself, my kids, my other family members, my people I work with, and then I'm going to impact hospitalizations, deaths. I'm going to impact employers because we're going to be sick and can't work. I'm going to impact schools. I'm going to impact, indoor functions. They're going to mandate masks, all these things that we don't want, but it's going to happen because we're in the I, me phase. People need to step back and say, do I want to travel? Do I want mandates? Do I want to be able to go to a restaurant without showing a card or a digital proof of vaccination? Y'all, here's what's going to happen. If we don't step up and say, I want to do something right, I want to look at my personal responsibility. And if I'm immune to this, I've had it in the past, okay, let's talk about that. But if I'm not immune to it and I've not been vaccinated, here's what's going to happen. Mark my words. This Delta variant is going to go away in about 4 to 6 weeks. Okay, something, it'll start to peter out. Then in December, January, Lambda or Delta Plus or whatever, Delta plus 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 is going to arrive, and it's going to be resistant to our every treatment that we have. That's what's going to happen. You think we're going to get out of this cycle? We're not, until we get into the us, we mentality.
Dr. Watson, you said it. I don't think I can say it more. I don't think I can add anything more emphatically than Dr. Watson just said, and I ditto that.
So one of the things we're going to now, this is the beginning of a transition to talking about vaccines and a lot of the issues there. And I want to begin that journey. And look, one of the things we're going to talk about is how we can persuade rather than shame people into getting where they need to be, and that means dealing with misinformation and setting the record straight, hopefully in a respectful way. I think this is going to be an opportunity to do this question, and the question is, of the people hospitalized, the 70 to 80, 69 to 80 or so, how many are hospitalized because of COVID? And how many are hospitalized for other reasons and were given a COVID test upon admission and simply happen to have COVID? And I'd like you to answer that question, A, and then B, my follow-up question is, what difference does it make? Which of those things is true?
Yep, I got it. So I apologize for jumping in on all these answers, but is that out of the 70 to 80 that we have in-house, typically the majority, all but 3 or 4, will typically be admitted based on COVID. We will identify them. We have a running list we monitor, but we know, and we call the others incidental. Those are the incidental positives. We want to recognize them only because we want to make sure that we're wearing the appropriate attire to prevent infection to our colleagues and to other family members. But those are not the ones we're talking about. We're talking about the main group, the 69, 70 people that are infected and suffocating from their inflammatory lungs in the hospital. Those are the ones we're talking about on this call. The other ones, incidentals, no, they'll do great. We educate them, we protect ourselves. So I hope that answers your question well enough.
And Skip, to your point, what does it matter? Right now, we have to meet people where they are and find out where they are in their understanding. We have done everything as a community and nationally to kind of get the word out about vaccines and try to get people to trust so that they don't end up to be the people in the hospital. And if you do, perhaps you'll survive being in the hospital because you were immunized. But I think as we start approaching and again discussing vaccine hesitancy, you have to meet them where they are. So every person needs to be an ambassador, and especially those people that did get vaccinated, and discuss it openly in a respectful way, because everybody, you have to meet them where they are. They don't know, we're not all experts. We're not experts. I'm not an expert. Thank you for introducing us as experts, but we are learning, and we are professionals that have a skill set that's able to adapt and understand the science behind this. And it's our goal to try and meet people where they are so they can have a better understanding. We hear people like, I'm scared of shots. I'm scared of shots. When they said that I had to be one of the first people to get the shot, Dean was laughing because he knows I'm terrified of shots. But I did it, and I did it on video so everyone can see. And then I walked through the hospital, and the next day and the next day, sitting on different floors and talking to people that work here, and let them see my arm and let them ask me their questions and make sure a magnet doesn't stick to me. And so you have to be respectful. We're treating people in these beds regardless of, it doesn't matter how you got there. The fact is that you're sick, and we're not, we're not shaming people that are in those beds. We are trying to cure you. We are trying to get you through this. And so all of this other political nonsense and discussion, that's not who we are as healthcare people. Are we frustrated, tired, and miserable that there is an option out there that could keep you out of that bed? Yeah. In that sometimes it's difficult to not convey, but and again, we just have to get people to understand that we are really, all the things that we thought we were going to possibly happen the last time when we got to our height of our numbers and we started falling down, everybody got excited. We had vaccines come out in December, people were getting vaccinated, then it just fell off. Then they said, oh, everybody that's vaccinated cannot wear a mask, move around, be free. Everybody's like, yay, let's go. Well, then the people that did not take personal responsibility, i.e. putting on your seatbelt, they were like, nobody's going to see. How are they going to know I don't have a vaccine? I'm going to go out without my mask. Well, guess what? Right now, you are seeing how we know you didn't get the vaccine.
Yeah.
Can I add to that, Skip? Because Andrea, I
Sure.
thought that's excellent. And I just, a couple of numbers just to throw out there. One is, just so everybody understands, there's never been a larger study in the history of the human race. 2.3 billion with a B doses given worldwide. 190 million doses given so far in the US. Is that enough? No. But the point is that we have studies galore going out here to determine safety, and it's safe, to Dr. Friall's point. And also the other point is, she's right. We don't want to be judgmental. We understand. We want personal choice. And if you have natural immunity, let's talk about that. You do get a benefit from the vaccine, but let's talk about it. What we're focused on, highly focused on right at this second, is individuals that do not have any natural immunity and have no vaccine and they're eligible. Let's focus, let's get together, let's talk about it, and let's look at the evidence. We're not going to judge your choice. We're telling you, we just want you to be responsible and think it through.
So one of the things we've advertised for this forum is that we wanted also to arm people with the best responses and the best way to get the unvaccinated to be persuaded to get vaccinated. And so what I want to do is just go through some things that you hear folks that are not vaccinated say, and maybe you could model the best response for our audience to convince that coworker or churchgoer or family member or whoever that that's not good enough. And viewers, if you have some of these that you'd like a specific response to, this is a great time to send them. So things that the unvaccinated say that you would like to be able to respond to, other than eye rolls and things that aren't productive, right? So we're trying to find constructive response. So here's one. This vaccine didn't go through testing trials and we don't and didn't get formal approval, we really don't know what the long-term effects are. What's the best response to that?
Yeah, I'll take that one real quick. Is that a lot of misconceptions out there. mRNA vaccines, and by the way, Johnson & Johnson's vaccine is a typical attenuated virus vaccine, and it has gone through over 50 years of studies. So, but I think they're speaking about the mRNA vaccine, the Pfizer Moderna vaccine. mRNA technology has been in existence for over 40 years. And in actuality, in over 10 years ago, or I shouldn't say that, over the last 10 years, when MERS, MERS, was being investigated, we're looking for solutions to impact MERS, and you can look all this up. Actually, the mRNA vaccine came back to the forefront. Just until that time period, they were having a hard time stabilizing it to make sure it would not be destroyed upon entry and make sure it worked. Here's the beauty of the mRNA vaccine. So I want everyone to hear this loud and clear. mRNA vaccines do not enter the nucleus of any of your cells in your body. Well, why is that important? I don't even know what he's talking about. Well, the nucleus is where all your DNA is, okay? mRNA vaccine does not interact at all with your DNA. It enters the cell and it tells your body to say, hey, I'm here. I need you all to produce this protein so that your body can produce antibodies. And then that vaccine is destroyed. It's gone. History. There's no side effect. You're done. Okay. Let me talk, so flu shots and things like that, they help your body by using the DNA to create mRNA. So they've designed this thing to say, hey, we're going to skip all that baloney. We're going to come out and we're not going to hurt you because we're going to be outside of the nucleus and it's going to work. And it does work. So those are the things that I will tell you. This stuff has been studied as back far as the 70s, up until the 2000s, where they said, you know what, we're starting to get some stabilization. They shelved it. They shelved it for infections because they were looking at it for uses in other things like cancer and things like that. And thank goodness that they had done all that research waiting for this opportunity. And that's why you see it move so rapidly into production. And again, I'm going to go back to my point. 2.2 billion plus, or 2.3 billion plus doses given across the world, and 190 plus million in the US. We're watching for all these things. Nothing's happening with regards to side effects that you would be concerned about, other than feeling like you may have the mild flu or something like that.
Isn't it also the case that even if there is unknown risk, it would be very difficult to argue that risk is anywhere close to the benefit? I mean, and back to seatbelts, I'm sure there's been a time where if someone wasn't wearing a seatbelt in some bizarre crash, that they would have actually been better off if they wore one, but you would never use that example as a basis for not wearing a seatbelt, right?
Yeah, and I would. That's a great point. I meant to make it. I'm sorry. Is that when you look at actually getting infected, the risks related to the infection far outweigh any risk to vaccine. Even when people talk about clotting and they talk about myocarditis, inflammation of the heart, talk about kidneys, talk about lungs, talk about long COVID syndrome, which now is impacting up to 30% of people that have the virus. So yeah, absolutely, it's safer than getting the virus. That there's no doubt about that.
Okay, so some people who get let's go back to things we hear as reasons to not be vaccinated. Some people who get the vaccine still get sick. I would rather just take my chances. That goes back to severity, right?
I'll take that.
I would agree with that. Yeah, when you still get sick, and again, but the goal is to not be hospitalized and not to die. And so taking your chances also means being responsible. So your chances are different. You still have to mask, socially distance, and be responsible within the community. So if you're going to make your own personal decision not to arm yourself with every layer of possible prevention, then you have to be personally responsible. You can't pick and choose in between. That doesn't make sense. Yeah. So yeah, if you're going to take your chances, take yours, but not the people around you.
So remember, excuse me. I need to say goodbye to our WFSU audience and thank them for being here, and remind them that a recording will be made of this broadcast that they can go back and listen to what we're going to do from here on, which is going to be very important. So thank you, WFSU. Okay, Dr. Watson,
Yeah,
go ahead.
we've been trained well on that. We paused. So, but just as a reminder to everybody, and Dr. Friall is right as always, is that when you look at this, people say, well, I get sick when I get a vaccine. Again, I want to remind everybody, it's not breakthrough, it's expected, right? If I tell you I can flip a coin over and over and over again, 50% of the times heads, 50% of the times tails, I'm not going to say, yeah, but 50% of the time I get a tail and it's a breakthrough. No, it's not, it's expected. So if the vaccine is 88% effective or 94% effective, 12% or 6% are going to get infected. It's going to happen. It's going to happen, but they're not going to die. And that's Dr. Friall's point. These people are going to do well with the vaccine. It's expected.
One thing that may be helpful, we're supposed to be giving helpful responses here. So I think if someone were to say to me, you know what, I really hate getting the flu shot, or I don't even want to get the COVID, I get sick every time I get a vaccine, then I said, perhaps you should plan accordingly. And if you know that you perhaps get ill for approximately, a day or so, maybe get your vaccine on Friday. So a helpful way to answer that question would just be, you may get slightly ill, but you're not going to die from the injection. So perhaps also another way would be to plan out when you would get your vaccine.
So I want to come back to you, Dr. Friall, and ask one of the things that can mean more to people sometimes even than good health is people are going through fertility challenges. Can you talk about there's some folks that have heard that their fertility could be impacted by the vaccine. Is there any research or evidence that shows that?
Again, just for the people that weren't at the top of the hour, the American College of OBGYNs, as well as the maternal fetal medicine, have put out that vaccination is safe for women, that there's no real evidence that there's any fertility issues. I think some of the questions that people have that stem from this is that, oh, I got the shot and then my menstrual cycle, I skipped it or it was late. One of the best explanations I had for that was a lot of times, even when we're really ill and your immune system is ramping up, people notice that when they have a cold, sometimes they don't get their period, it skips. It's not long-term, I'm never going to be able to have children. It's not like inserting itself into our genital, our fertility organs. So but it's a valid concern because, they think, oh my gosh, I don't want that if I'm trying to get pregnant. So it's not long-term. Maybe your cycle may be late or you might skip it, but it's not inserting into your DNA that should be affecting your reproductive cycle.
I'm curious of the people that are being admitted. So Stephanie Derzapolsky with TMH, VP of Marketing, made a very compelling Facebook post recently about people that have been admitted and that are begging to get the vaccine. And obviously it's too late by that point. Have you talked to people? What's the primary reason that people that have been admitted didn't get the vaccine? Have you been able to gather any of that type of information?
Yeah, just let me remind everybody kind of how it works at Tallahassee Memorial specifically. We have a COVID team, and the COVID team is specific to COVID. That's an obvious one, right? But this is all they do. And so we have that team and they're having conversations with the patients and their families. And it's interesting it's all the myths that you're talking about. It's the social media conversations about things like Dr. Friall's pointing out that really have kind of infiltrated the population, and I can't figure it out. I will say that it is interesting to watch because some of them, 80% probably will say, you know what, to Stephanie's point, yes, I wish I would have gotten the vaccine. 20% are still reasonably resistant to the conversation, but it is all the things that we're talking about on this show, worried about having things implanted, worrying about religious things, worrying about metal, worrying about becoming metallic, worrying about infertility. It's all those things. And a lot of people really believe what they read on social media or in social media content.
Okay. Go ahead, Dr. Friall.
Oh, I was going to add that worried about being tracked. I think that's one of the bigger, one of the big myths out there also, or what we think is a myth, but it's funny that people say that as they're looking it up on their phone, that is literally tracking them. So it's just, if we're injecting that, I think you're already in the game if you're picking up your phone.
here's the last thing, one of these examples I want to give, and that is I already had COVID, and I saw a study that showed my immunity is as strong as the vaccine. And a cousin of that, and I'll be perfectly honest, I probably waited a month or so longer than I should have to get mine, because I just had COVID PTSD, right? I just didn't want to put that stuff in my arm because I was really, really sick with it. I mean, I was very anxious, and I did have a mild reaction, so mild compared to what I actually had. And it was a, frightening thing. So what's the best way to respond to those two folks?
Yeah, so natural immunity, as we were talking about at this time, appears to be good. The issue is, as we talk about a lot in other venues, is that with Delta, we're not sure yet. It just arrived over the last 3 to 4 weeks. It's really been aggressively infiltrating, individuals, their bodies. So we don't know the answer to that. So our answer is always, look, natural immunity is always the best. We respect that. Unfortunately, this virus, as to Dr. Friall's point previous, this virus is mutating rapidly. And so when we start to see more reinfections, people that have natural immunity and then become reinfected, we're really going to have to be pressuring people to get aggressive, even more aggressive on vaccination. So what's the benefit of getting vaccinated if you have natural immunity? That would be my question. Well, here's the benefit. And to your point, Skip, when you get vaccinated, and if you've been infected in the past, you are going to see a pretty significant immune response, because the body's going to recognize the protein being produced. It's going to say, hey, we know you, we're going to produce antibodies at a higher level. That's the immune response. That's a benefit. So when you elevate your antibodies in your body, you are more immune to the virus itself. What's the other benefit? Well, through mRNA, we can identify the variants and focus on the variants and guarantee you to 95% assurity that we're going to impact and prevent your infection from the variants. Those are the big ones. I improve my immune status, and I'm going to be immune to variants. We can't guarantee that with natural immunity, but as of today, to the viewer's point, it's pretty good up to Delta. We'll keep you posted on Delta and then Lambda and then on and on and on.
Okay, so we need to dive into the issue of children, and I'm aware that this has become a huge political issue. I'm not interested in getting into the politics of it. We're here to talk to experts on the science. And by the way, if you're on a call with me, you're just like automatically an expert. So because we all know that I'm not. So why don't we just kind of try to break this down? First of all, where are we with the vaccine and it being eligible for younger and younger people? And is there any age where deltas, as you get down towards infancy, is there any age where delta's impacts have diminished? And just basically, where's the current science on how this variant and the pandemic is affecting children?
I can start, and Dr. Friall can clean up like she always does for me. Is that the vaccines, again, 12 and over for Pfizer, 18 for Moderna, but both Pfizer is aggressively studying the vaccine for pediatrics. The assumption is that will be the EUA will be looked at rapidly in the near future, obviously, because school is coming back in session. I will tell you, from the infection standpoint, Delta doesn't care if you're 1 month old or if you're 101 years old. Okay, you can look at the data, and Dr. Friall can update on that too. But is that you look at the data across the Southeast, and look in Florida, pediatric cases are up, and locally, we've had kids from the age of less than 6 months and then up to 18. So it doesn't discriminate. The virus loves to learn how to live, and it's going to try to exist and mutate to maintain its longevity.
Yeah, I think unfortunately watching the national news last night saw that Florida had over 170 cases and leads the nation in hospitalizations for children. The things that we have right now is that we could at least get our children that are 12 and over vaccinated. And then we are still waiting on additional approval for 12 and under. But also back to those pregnant women, especially once you, the hesitancy just is so understandable, but there is evidence and data showing that the babies that are born to vaccinated mothers have antibodies and have high level of antibodies. And we know that when in pregnancy, specifically, an example of this is we give whooping cough or Tdap to pregnant patients, not for mothers not to get whooping cough, but for the children to be protected once they're born. So that same thought process is what is what is also pushing at least moms to help with those newborns, so that we don't have those little babies infected in the unit and give them more of a fighting chance.
By the way, we're getting a lot of questions from folks with really individual details that wouldn't necessarily have applicability for our larger audience. We really want to encourage you to reach out to your primary care provider or even pediatricians with those questions. Okay, so Dr. Watson, what is the synonym I'm allowed to use for breakthrough? Because I have a question that has breakthrough in it, and I don't want to get sent to timeout.
That's fine, breakthrough's fine, but it's expected, but breakthrough's
okay.
Fine.
So is there any data that shows that breakthrough percentage varies by vaccine type?
Right, so yes, great question. So the average is 88% effectiveness for all vaccines in the US. We're using 3, right? We're J&J, Moderna, Pfizer. Interestingly enough, J&J's effectiveness is dropping, so it brings the average down. mRNA vaccines are still rock solid and working. And I know there's going to be questions about boosters and things like that. But we're right now, Pfizer and Moderna are still rock solid. J&J has dropped most recently even below, well, it's dropped from 30 to 60% effectiveness with regards to complete protection for against Delta specifically.
So if somebody got the J&J, should they be considering moving over to an mRNA vaccine?
Right. Yeah, so it'll be interesting to see what happens. The J&J data is still 100% reduction in death, right? So that's still great. What we're talking about is antibody production to a level that they feel is effective enough to prevent the Delta infection itself. So they're still producing antibodies. They're still going to benefit. They're not going to die from Delta, but they may get sick, and it won't be severe, but they may get sick. So when we look at it, are there studies out there? Other countries are going from J&J or to an additional dose of an mRNA vaccine right now. I mean, would it hurt you to do it? No. There's no problem with getting an mRNA vaccine after a J&J. We actually mix and match for people that have reactions to the other vaccines. So no, not a problem.
Is there any local data on breaking down vaccinations by demographic groups? I assume that the younger you are, the less likely you are to have been back to get the vaccine. Are there other breakdowns by gender and ethnicity and any other way we break stuff like that down?
Yeah, there are. And actually, if you go, and Claudia, she may be on this call, the Department of Health, she does a great job breaking that down for everybody and managing all this, by the way, but Claudia Blackburn. But the issue is that if you want to look at this stuff, there are plenty of websites you can look at. CDC has a great website.
Great website.
Central. And then there are others that actually break it down by sex, age, all of the different ethnicities. But I just want to remind everybody, if I may, just real quickly, locally in Leon County, when you look at our data, and we're focusing on eligible populations, the 12 and over population, 49.1% have completed their vaccine of the eligible populations in Leon County. That's not good, right? But let's talk about something positive. We're going to uplift, right? Is when you look at who's had one dose about 58% have had one dose. So you're starting to see people activate. People are saying, you know what, I'm going to get vaccinated. I just haven't completed my series. That's a positive. If we can get, 70, 80% of 12 and over vaccinated, we'll do very well. And the other positive is that 85% of our 65 and over have completed their series. We're not seeing them getting sick and hospitalized. So we just got to focus and, again, educate, do your research, determine if it's right for you. And if it is, and I hope it is, 12 and over, let's go out and get vaccinated, drive that, that 49.1% up to the 70 to 80% range.
By the way, people that have had COVID and have that immunity, sounded like you were saying better safe than sorry to go ahead and get a shot. What about the second shot? Is that become really kind of excessive, or should they get the second shot?
So here's the deal on that, is that the studies are ongoing right now as we're talking. And I just want to reemphasize, natural immunity is really, really, really good right now, but we don't know about Delta. The issue is Delta and then the following viruses. So the mutations that are coming. If you have natural immunity, it is best to get vaccinated to drive those antibodies up and to protect you against variants. So there's no doubt about it. But the study related to one shot post natural immunity versus two shots is still pending. I have an opinion on it. I'm not going to tell you what's no, can't do it. But at least go out and try to get tolerate that vaccine. I know you will, and do the right thing.
Lean your head left for one or right for two. Wait a minute, it's my right. That's too confusing. Hey, on the boosters, so are we kind of headed towards a real kind of medical ethical dilemma here when it's booster time and we have yet to get to first shot levels that we need? How's that gonna work? Are we just going to say, hey, if you're not willing to get in line for your first shot? Well, first of all, is the booster different than the first shot? And just give me a booster primer here.
If you're going to get, you would get the vaccine. So hopefully the people that have been vaccinated, technically you can't boost someone that didn't get a vaccine in the first place. So the boosters would be for
taking somebody's shot by getting a booster, right?
Correct. You would be getting the booster and the other person would just be getting vaccinated. Yeah,
okay.
Absolutely.
And we have any, rough timeline on that? Would you expect that to be before or after the beginning of the year?
That's where I don't know, Dean. I don't know if either one of us knows the answer to that, but
so
it may be by the end of the year if you're thinking of an annual type of booster, and we hadn't really had much. We didn't start our vaccination process or even get our first vaccines in the city until December. So I would imagine that between 9 and 12 months would be that booster time. And so we hopefully will know something over the next few weeks of whether we would need a booster.
Let me tell you what impacts that. Dr. Friall's right. What impacts that is the number of people after this conversation that go out and get vaccinated, because the more people that are vaccinated or have natural immunity, lots of conversations about that. I'm not saying that's not a good thing, but the more people that get vaccinated or have immunity in general, the less likely you're going to need any booster. Okay, so that's important to understand. If you wait and you don't do it, I'm going to think about another 6 months. Well, you'll be thinking about it during our next peak, and we will be looking at getting boosters because we have to drive that immune system to the point that it is protective, and we have to focus on the right protein, right? That spike protein and this coronavirus, which is what these antibodies are directed to, that spike protein is mutating aggressively. Why? Because this virus wants to survive, period. It doesn't worry about you. It doesn't care about you and your family. It cares about itself. And so that's where we're coming in and saying, look, the more people that are immune to this thing, the better off we're going to be in December. Otherwise, we'll be having this conversation again, talking about different vaccines and probably not any options for treatment. But so that's what worries us.
So let's go back to children a little bit. I don't think there's anybody that argues that there isn't some downside to children not interacting with each other and in social settings and having masks on. I mean, that nobody wants that and thinks that's a good thing, right? If you're talking about unvaccinated children, so children under 12, what is the like sweet spot of how they should be protected during the vaccine. So if my 8-year-old is playing outside, should he or she be masked, or inside? What should life look like for an under 12-year-old?
I was hoping Friall would take that one.
I knew you were hoping I was going to jump in on that one, because that is just, there is not a vaccine for the under 12. So the first thing is, you follow guidelines about being socially distanced and being outside with, if you're playing outside with other kids, you just have to follow the recommendations, because we have not reached an amount of immunity within the community to safely say, hey, let your kid just go have fun everywhere without a mask on, even at 8 years old, right? So are you going to bring them indoors or even outdoors with other kids closely related that, playing around? We don't have they can spread the virus just as easily as adults can. And so we are in a quandary with what to do with those kids that cannot be vaccinated. So the best thing that we can do for right now is to try and keep them as safe as possible. There's no great answer for that. And you do want your kids to be able to go out and play safely. Do you cohort? I know a lot of parents have been having play groups together, but school's opening. I am not touching that, but I will just say, these are very difficult conversations to have. And so, because everybody wants their kids to be safe, and one kid in the ICU is too many. One kid hospitalized for COVID is too many. So, that's where the personal responsibility does start to wane on other people. So I will say that if you know that, we have people that let their kids knowingly that have positivity around them still go and play or go to school. You can't do that. We have to be responsible when you have positive contacts, and not pretend that it can't affect those children and that it can spread to others. We have to be responsible.
Dr. Washington?
I think that's a great job. Shouldn't this conversation be taking us down the road of, isn't this enough is enough, right? And this is a year and a half in. We're now talking about this again. I can't breathe in my mask half the time, but I'm doing the right thing because it is the responsible thing to do. It's the right thing to do. People need to hear this and say, goodness gracious, here we go again. My kids are going to be impacted again. They're going to be back in school with this, nothing's normal. And what we hear out there is, hey, how do we get back to normal? And my response is always, well, do you have immunity or have you been vaccinated? No. But when's it going to get back to? It's not. People engage, they have to be immune one of the other ways, right? Either you have natural immunity or you have vaccine-induced immunity. It is not going away. I'm telling you all, if we don't take this seriously, December we'll be talking to each other either about Lambda, okay, which is a bad actor, or we'll be talking about Delta plus, whatever the next one is. So this is the time to say, I really would like to get back to normal. And so would I. I would love to get back to normal. Get vaccinated, or if you've got natural immunity, let's talk about it. It's still going to help you to get vaccinated to prevent further mutations and to drive this thing into the ground so we can get back to living our lives. We want people to live normal lives. We don't want to mandate anything. We want people to make the right choice.
By the way, can you define natural immunity? We have a couple of people asking for a definition of that.
Yep. Is it humoral immunity or natural immunity? Means that you have been exposed to the virus, infected, and you may not even know it, right? You may be one of those 70, 80% that are walking around as carriers or infected and impacting others, and you generate or produce antibodies to that virus. Once that occurs, your body's B cells and T cells will remember that antigen, that protein, that virus, and they will produce antibodies into the future. And that's what we're seeing. We're seeing over 90% of people that have been infected in the past are still producing antibodies. They have the ability to fight off the infection up until Delta. Delta makes us a little nervous because it's starting to mutate to a point where that spike protein is becoming a little resistant to therapy, okay, or whatever therapies exist, and resistant to antibodies. And that's why we're telling you vaccines are beneficial, even if you have natural immunity. And I understand that, look, I'll sit and have a conversation with anybody about natural immunity. If you have it, look, I support, you've got natural immunity, but let's watch what Delta does. When we start to see reinfections, we're going to have to talk about vaccinating immediately, or else you will be impacted. But right now, everyone appears to be good. I'm sorry to keep reiterating that, but
No, that's okay.
Yeah.
So on the back to the, we've got some questions on the Delta variant, and this is, I really like this one because early on, the word on these variants were more contagious but less severe. Now it doesn't seem like that's the case. What changed in our understanding and that happened?
Well, the viruses are continually mutating. And when we talk about Lambda, just
And
remember that we are
mutating means what, Dr. Friall?
mutating means the mutating means that the virus changes, and the virus can change. You know, in the very beginning, I remember having these conversations with Dr. Watson and hoping that the virus would mutate or change such that it is less virulent, meaning that if you get infected with it, you might get a tiny cough instead of pneumonia. But instead, some of these variants are more aggressive and they're more virulent. And when we say Lambda, remember they're naming these variants according to the Greek alphabet. So when you get down to Lambda, there are, they're keeping going. And some of them they may not bother you so much, the beta or whatever, but some of them are more aggressive and more virulent. And so when you do get infected, you have more severe symptoms. Dean?
Yeah, and that's great. And I will tell you that some of the questions that I get from my friends are, well, you all told us that we didn't need masks, then we do, then we don't, then we do. And then the virus, to your point, some are virulent, meaning aggressive and transmissible. And then you tell us they aren't, and they are. It's science. We don't know until things change. And as scientists, we have to review the literature on a daily basis and then convey that to the public. And that's not easy to do, right? We're talking about variants. We're talking about changes in the spike protein. We're talking, so things change on a daily basis. And that makes it very difficult for anybody to convey changes, because as humans, we want to hear, all right, tell me what to do. So you told me this, now you're changing your story. We're not changing our story. We're telling you that the virus is changing and it's trying to survive. I want to tell you that the studies show that this thing is 50 to 60% more transmissible than Alpha was. And now what we're seeing is it has mutated, to Dr. Friall's point, and it is impacting lives at a young age. Whatever people have said in the past, this thing is taking young people to task.
And to the point of the question about, well, why should vaccinated people be masked? Just that point is that simply when you're in an area where you are a hotspot, everybody's seen the map of the United States in red. I don't think there can be a more red state with respect to how hot we are right now. Even vaccinated people can get infected, but not die, right? Hopefully. And the more virulent and more virus there is out there, you have to continue to wear masks. So until we can get those numbers down, then even vaccinated people may have to wear a mask.
Two more questions on vaccinated people wearing masks. That was an amazing segue. I think there is a lot of confusion on the CDC direction for that. Is that necessary? Explain why a vaccinated person should need to wear a mask, other than you can't tell the difference between a vaccinated and unvaccinated person, and so it's basically a way to account for that reality.
Again, I think the CDC specifically says in areas that are hotspots, that right. If you have a high, so because we also know that persons that are vaccinated can still carry the virus in an area such as ours right now, where you do have increased transmission. That's why the masks are being worn, to reduce still those, because I may have COVID tomorrow. I may not go to the hospital. I may just have a cough, but when I cough and I have COVID, then I can still spread it. So you need to wear your masks.
So this is still about protecting other people, and then from a public health standpoint, it's basically because too many unvaccinated people aren't wearing a mask, and we need to achieve some kind of something there, right? Is that fair, Dr. Watson?
Yeah, so it's beneficial from both directions, right? And to Dr. Friall's point, if you have a vaccine that is 95% effective, which we do, or 88% across the board, you have a 5 to 12% chance of getting infected and carrying the virus. So, and what's happening, to your point, Skip, if I can go back to your comment about mass identifying people that are vaccinated or unvaccinated, no one's doing that. People that are unvaccinated are not going to be willing to wear a mask to wear the scarlet letter. It's just not going to happen. I mean, and so when you have people that are, when you have a high concentration of infections, we have got to protect everybody. Again, I can't breathe in a mask half the time. I don't want to mandate all of this stuff. I want people to make the right decision so we can drive this home and get back to normal life. But people aren't doing that right now, right? We went over all the numbers. So it also, the other thing I would say to that is masks do prevent large droplets. So yes, they're protecting people from getting infected from me if I'm infected, but it also protects me. And I'll tell you why. Because, and we've talked about this before, with a mask on my face, I can't rub my nose, finger in my nose, finger in my mouth, and all that kind of stuff. So it reminds you, don't touch, wash your hands, right? So those are also beneficial there.
I know we're just a little bit over here, but our audience is still hanging in there with us, and I want to squeeze in a few more. Any visitation policy changes coming for TMH?
Yeah, currently we are having one visitor per day, aside from special circumstances, which you can find our full visitation policy on tmh.org. But due to the high spread right now, we recognize that we would like to limit visitors. We don't want to go back down to zero. So we expect all visitors that do come to the hospital to respect policies and wear a mask, hand hygiene at all times, and socially distance as appropriate. But we know and recognize that it's very important for someone to have a patient support member at the bedside when possible. Okay. So, but we would like you not to bring it into the hospital. So we're trying to balance that.
Okay, two more, and I promise that'll be it. Number one is, every flu year, people say, oh, well, this year's flu is you get the throw ups, or this year's flu is you get it. How is other than severity, how do the symptoms for a Delta variant patient differ from prior versions of the virus?
They don't.
Okay, so they're in that kind of variety.
Like you're walking in with blue spots and we'd say, this is Delta. It just aggressively progresses.
Okay, very last question. Should I still go to the doctor for non-COVID care or therapy? The answer to that Absolutely. Is a big yes, right?
Absolutely.
Great.
Absolutely.
Well, look, on behalf of our community, I want to thank not only Doctors Watson and Friall for being here today and answering these questions, but all of the people that I know are behind you that are doing amazing work. I know that no one wants this to be over more than y'all and all of the healthcare workers that are making immense sacrifice, putting themselves in harm's way, working unbelievable hours under unbelievable stress. So our community thanks you for that. We thank all of you who have joined today. We had a huge audience. Thank you for your desire to continue to learn and be informed. And I would just say, boy, very few people have been shamed into doing something different than what they're doing now, have been ridiculed into changing things. But if you can find a way to touch somebody's heart and to share with them information and concern in a really constructive way, I think that has the best chance. And Drs. Friall and Watson have modeled some good behavior there. If you have not gotten a vaccine, I would ask you to really just open your heart and mind to the idea that it's saving your life, someone you love's life, someone you may not even know's life could all be saved for the very relatively low risk of taking that step. So I hope you'll sign up to get that done sooner rather than later. Thank you, TMH, for everything you do, and I hope everybody has a safe weekend. Thank you for joining us.